So our role, Community Catalyst had a coordinating role, but we also had an early role in both engaging with the two sites in which our work was done, York and Wakefield, and in scoping both link worker and community capacity building activity in both areas. So as Kim said, we were looking for two places that we knew invested in and valued the work of link workers and people in communities, individuals and community groups. And we're also making major efforts to share power between local authorities and communities. And York and Wakefield were very obvious areas to select, and we were absolutely delighted that they were prepared to be involved and that they've stayed with us through a really, really difficult time. So I started by engaging with senior leaders, talking to Joe and Anna, who Anna is Director of Public Health in York, Joe is Head of Commissioning in Director of Public Health in Wakefield, Joe is Head of Commissioning in York. And then they brought together an amazing group of people in each place for what we call a kick-off meeting, which was to explain the project and to get people's help in beginning the scoping of all the activity in each area. And we squeaked in with those meetings just before lockdown. And in fact, I remember, Anna was amazing because as Director of Public Health, she had a key role in COVID, managing the response to COVID, and still managed to bring together an amazing group of people at the very last minute. So, and huge thanks to both areas for all the help they've given to this at a very difficult time. So, as I say, thanks to senior leaders, we were able to identify and talk to both link workers across a number of sectors and community capacity building organisations, and our role was mapping. So we were trying to understand what they did and make what they did comprehensible to the next delivery partners. We were looking at the same time, at the approaches they were using to measuring impact. We were looking for, gaps and duplications. And then we produced some baseline information, which is the information that the other three delivery partners used in undertaking their work programme. So, and we had some learning from that. What we found, we were amazed actually that there were people working a similar way to social prescribing link workers in lots of sectors. So I've got strong memories in the meeting with York of the police being in that meeting, housing, who were employing link workers to support their tenants, local authority, of course, and VCSE organisations, as well as health, and loads of different groups and organisations that had a role in community strengthening, community capacity building, using lots of different approaches and with very different funding sources. So some were local authority funded, but there were other sorts of funding sources which were of real interest and showed both the diversity and the financial resourcing of community strengthening activity.